Yeah, I did it for her. I just had her hand here.
You can put them.
If you're using the same hand, then use the left hand.
Okay.
Okay. She can see you. Okay, so you want power?
And the left hand, why?
Left is good.
Why? Why?
Easy.
Okay.
So we're using this to do here. What are we doing?
Okay, so remember the protocol of the
Stand thing is where?
What's TW stand for?
triple warm-up.
Triple warmer. I honestly don't remember doing that for the varicose veins at all. I don't remember doing it for the varicose veins.
There was a small topic that came in.
You've it written?
Yeah. So now the camera is not on that.
We just talked again 5 minutes on it.
I remember doing varicose veins, but I don't remember reporting.
In drop.
Okay, that's for the next one. So after you pass the video to storage or
Yeah.
Three to this bone. How much difference?
Okay, now we're going to start
This
with the time.
to this. This to this.
This to this. How much?
2, 1.5, 2.
Us? A bone to KI3. How much difference?
Army,
Bone to KI3.
two tunes. Two tunes above and just next to your wall.
From the kidney 11 to stomach 30 is motion.
So this is
Kidney 11.
1.5 tune.
two tune total from the center. The kidney level is just half tune from the center. Right? Kidney level is half tune. So total is.
Are we ever going to like be on the exact point, really?
Little bit up down there's no problem. The in acupuncture, the way of inserting needle and the proper stimulation, that's the more important.
Okay.
Pitta tongue. The first time of the pitta discolorations on the all over the tongue. You will find some black spots or tongue itself become black. Black and what you say that's the your for example.
So this tongue itself is quite black. It's black.
This is what I know.
Everything
My
on
mind,
the
the whole tongue becomes black again.
So what is this? What is this?
This also, this is like acute cases one. In the future it become like this. Okay?
Whoa.
Oh, wow.
And last
This
one.
crack also.
How is black in full of spots?
Black, black, just black full of spots.
This is really bad one.
They
Yeah.
all look bad.
The
Yeah.
next one.
Oh.
What was the worst time that you ever saw?
Really, he has different classifications. 2010.
All the colours, all the cracks, all the
Maybe he
teeth.
has it.
Who's that? Who has it?
I would not have believed that such tongues exist.
The
On
neither. I'm just thinking, is that for real?
I feel like they took a sweet and then turned that colour.
Yeah.
Like deep black sweet. My thought.
Yes.
Now the bar is from this side. Okay, which is the more loud sound wow, okay? Let's see who is going to win the wow. Okay? So this is
No,
the
hers
picture.
was echoing, so she obviously.
This is 2. Yeah,
Looks like a raspberry.
Yeah.
What about that one there?
Did you
The
take these
one on the
pictures,
left.
Annie?
This one?
Or the left, sorry, my left, yeah. What's all, it's has loads of lines though as well, no?
Yeah, yeah.
Loads though.
Nemi, did you take these pictures? Or your patient?
That's a crazy thing.
What I had the picture that all is my pictures. What I receive from somewhere, for example, sometime I see some good picture, for example, from the Google, I'll keep the separate. Okay, I want to match the tongue with my tongue pictures. Okay? So these all are imbalances we find all over the body. Okay? Not only specific part of the body, all over the body. Become like this. It's called like disturbance of your digestive fire. Okay, it means loss of the loss of the acids inside your body. The body is not able to handle the temperature of the acids, and your body is not able to absorb your amino acids. Anything what we are doing, there is process, then absorb. In these conditions, your body is not able to absorb the acids.
There are lots of acids in the body.
Okay, so this condition what happen? The body is not able to absorb the acids. For example, someone having like, have you seen the itching? If they scratch like this, the whole part becomes swollen and red. Okay, that is the reflections of the acids. Many people having these issues. For example, 2 weeks before I ate something and I had mild infections in my blood. So now it's much better. Otherwise, if I do like this part becomes fully red and becomes fully swollen for 10-15 minutes. Wherever I will scratch, that part of my body becomes fully like swollen and scratch. It's the kind of type of allergy. So exactly same. When your body is not able to absorb the acids, okay, mostly your acids, what we have is we discuss Vata 5 times, Pitta 5 times, and Kapha 5 times. But later, if you go proper in the Pitta, and Pitta is 18 times, right? All acid is helping and functioning for some specific, with some specific organ. For example, some acid comes from the spleen. After the breakdown the red blood cell, it's going to your pancreas. And pancreas is not able to absorb the acids because of the many reasons, maybe emotionally or dryness or any reason. If your pancreas is not able to absorb that acid, okay, then that acid will convert in the pathological conditions, in toxins, okay, and going in your intestine. If your intestine is not absorbing, and what is coming from your taste gland? Only acids. What comes from the acid? From your taste glands, reflection is only acids. Then slowly your taste gland become more sensitive. Slowly, and loss of the consistency of the acid is going on our tongues. So that part slowly our taste gland is going to block or going to damage. In future, the people may be having issues with taste gland. Okay? So if the overall the tongue become like this, that means in all over your body is not able to absorb acids. Okay? Not absorb is we discussed before, not 100%. Yeah, maximum percent of the acids your intestine or your all organ is not able to absorb. Then will come slowly a specific part of become the blood. Then in that part your body is not able to absorb. Specifically in that part, the body is not able to absorb the acids. So we focus only on that part. Okay? these conditions, the digestion issues is very common. Okay,
Hmm?
the digestion issues is very common because without acids, acid is doing the main role of for your digestion. The issues in this case, there will be different symptoms. I have not found any case which is the same patient is giving the on the tongue giving the same symptom with every patient. It's like pathogens. Which side is reflexing, you will find a symptom there. All over the body become imbalanced. We don't know from where we start. If you go with this protocol, if you go with origin treatment, the root cause treatment through the nadi parikshan, that will help you more. Because if the whole tongue becomes black, how will you diagnose from which organ we have to start?
When
I was going to say
Diabetes is always help for this. That's the you can go. But sometimes it's very difficult to target this specific organ. Sometimes excess heat is comes from reproductive protocol. When we're talking about the reproductive heat is like the strongest heat in the human body. Okay, when the heat is start to reflex now, that is giving you lots of problems. Your emotionally also, your hormonal or your pathological issues too. Your reproductive heat is giving the lots of the problems in our body. Okay? So, and the female also, when you are targeting the female hormonal issues, any types of the hormonal issues, first you can do only reproductive, then we will go with a specific diagnosis. If female is complaining any types of the hormonal complaints, okay, first go with only reproductive. Okay, then we will target it as per diagnosis or pulse, or you can go with crown. Okay, so for the hormonal, reproductive is very specific for women, is very helpful. Okay, so in future, if there is I saw some case, the common case of the black tongue arthritis. When acid is not absorbing, they start congested in the joints.
anything
The
else?
all acids start to congested in the joints. Rheumatoid arthritis, okay? Rheumatoid arthritis, muscles cramp and stiffness in muscles. There's lots of stiffness in muscles because that all acid are just running your storage water and releasing lots of the lactic acids. In future, there is very high chances of the cancer.
Oh.
Okay.
That's because it's acidic environment where cancer proliferates, yeah?
Yeah, and autoimmune disease. Mostly like arthritis also comes under the autoimmune disease. Sometimes cancer also comes under autoimmune disease. Fibromyalgia also comes under the autoimmune disease. Okay. What is actually autoimmune?
Fibromyalgia.
Last one, what is it?
Fibro.
Fibromyalgia. So what is autoimmune disease?
The body attacks itself.
It's saying like one of part of your body cells is damaging another. Actually, mean of that is like this: one temperature is going high, so of course they are going to give the lots of the problems in another temperatures. For example, in the blood we have the red blood cell and white blood cell. White blood cell is like a little bit cold and red blood cell is a little bit warm. If there is a high range of the excess movement and excess temperature in red blood cell, then they are going to melt the white blood cell. When your one temperature will go high, the other one have to go down, right? If your pingala nadi is hyperactive, then of course your ida will be underactive. Understand? So one temperature will go high and one temperature will go down. In this condition, the psoriasis case is, you will find some psoriasis case. Psoriasis. stimulating your anger emotions a lot. Stimulating your anger emotion. We have one small protocol that's a help a lot to absorb your amino acids or any types of the acids in all over the body. Remember what we are talking, that is the black tongue, all over overall tongue become the black, not the one specific part of the tongue. When we come on the specific part of the tongue, then we'll discuss about that, and we have a different protocol for that. For example, this is the mostly, if you see the more black tongue, only on the lung area. If you can see, the more black tongue is only on the lung area. Okay? Can you see this?
Yeah.
If you see this one is only on the liver. Right? वीडियो में आएगा।
लंग एरिया थोड़ा काला।
हाँ, लंग एरिया पे ब्लैक स्पॉट्स थे। Okay, write the point name.
This is for whole tongue.
Yeah, ST37 bilateral. In this we use all bilateral tongue. ST25 bilateral, LI11 bilateral, LI4 bilateral, and only DU14 is center.
L11.
ST37, where is the ST37? Okay, so ST37 is stomach 25 bilateral. Okay, LI11 bilateral, LI4 bilateral, and DU14.
What's it?
DU or BU? DU.
DU14. DU14 is very good point for immune system.
It's back here as well?
Yeah, between the C7 T1. DU14 and LI11 we use for immune system.
What is after
LI4, laryngeal 4.
How by
So-
level?
Yeah, the general. He's saying it's for the entire lung.
Yeah.
It's a general protocol for all the entire lung. So, yeah, if you get catching too much cold and you fall sick often,
The first one.
This is the first one, or your first one?
I turn on the switch.
turn the fan.
Turn on. You are not turning on switch.
What did you say, Jyoti or Kushi? नहीं DU14 में
DU14 and LI11 both together. LI11 and DU14 is very good combination point for immune system. Okay, so all point I think you know, because Li11 we already discussed, system of 25 already we discussed, Li4 already we discussed, Du14 is between the C7 and T1, between the two vertical column, between the C7 and T1. Only ST37 is from the bottom of your patella 6 to
Bottom of patella.
just bottom of your patella eyes. The patella eyes is called stomach 35. Okay. From bottom of your patella 3 tune, 6 tune, the half tune lateral. From the bottom of patella to 6 tune down.
And
From half tune lateral side of your bone, the tibia bone. That is,
It's a muscle.
yeah, that is your tibialis interior muscle. That is your stomach 36. I'll show you this.
So 37 or 6?
37.
37. This is stomach 37. You can show it. Like this, how we count? From the patella, 3 and 3, 6 finger and 1 finger lateral. Okay?
Lateral.
Lateral. This is the lateral,
Yeah.
this is medial.
Okay, Mr. Gutman.
Yeah, both sides. This is all, everything is bilateral.
Bilateral, everything is bilateral.
Except the U, which is not single. That's a symbol for bilateral, that those double.
Okay, let's talk a little bit about the crown. Crown also help a lot to balance your two temperature in the body. Okay, because crown is directly function on your gray matter and white matter. Okay, on and your brain fluids and neurons. All what we have the nerve system on the brain. For that, gray matter, white matter, and spinal and sinus fluids. Okay, and there is one more fluid. I forget the name.
Lymphatic.
Is there a good way?
Okay.
This is
In what conditions we use the tree crown? You can use for good sleep. Okay. You can use for good sleep. You can use for the stroke paralysis.
Paralysis.
Yeah. Crown, write the symptoms, okay?
So we're using it for him, that's why.
Yeah.
That,
Start again.
For good sleep, for stroke, paralysis. Okay.
stroke.
Yeah, stroke paralysis, and we use for hormonal imbalance a secondary protocol. The first protocol we use as per pulse or maybe reproductive protocol. Okay, but second protocol we use the hormonal, any types of the psychological conditions. Okay? Because whenever your body become imbalanced, no, one specific nadi become hyperactive and one specific nadi will be deactive. Okay, for example, if you are using for your past memory, you always stuck in your past, then you are using more white matter. Okay, and if you are only on the future,
using like
okay, then you are going very high. So that means gray matter. Gray matter is too much. Okay, when we are balanced, we mix our both memory. We take the new informations and we compare with our past informations, or we mix with that. Then our body will absorb. Lots of times we do we take some decision, we do excess overthink, and we go in the future. But that is not related to our work or not related to our information, and we take the wrong decision because of with emotions only. Understand? When we go with one specific emotions, so we created problems. Understand? So this point is help a lot to balance your nadis, cold and heat, and balance your grey matter and white matter, and hormonal sleep. This will help for your psychological conditions, and very good for the good circulation in the brain, and good for hair fall also. Dandruff and hair fall.
Here.
See, in this condition, this will help you to protect from the hair fall little bit, because what happens if you have something imbalances inside your body, like if your liver is not able to produce enough collagen, if that is the cause of the hair fall, then it will create the problems. Second, if your left kidney connected with your hair fall, then we have to go with this also, because when we insert the needle will demand the more collagen. The needle will circulate the more collagen. Okay, so that will help your good hair growth. Okay, so you can apply and see there is good results and continue. Your hair will be like this.
What the hair?
What the heck? Okay.
This is Baba, and that's what
Yeah.
you said.
No, it is.
It is.
Curly hair is vata hair. Yeah.
There is some more psychological conditions when we come on the heart and medical. We will talk about the triple crown more, because we have many patients there. So you can practice from today triple crown. Okay. So how you use the triple crown? Tip of the ear, go exactly on the top. This is your Jan20. This point is your Jan20. When you go tip of the ear and go directly straight on the top, this is your Jan20. Okay? From the Jan20 to Jan20, first start from anterior part. From the Jan20, Jan20 forward, like here, on anterior part. Okay? Then go this all 3 round circle will go clockwise. Okay? This one. Then from Jan20, Jan20 right side. From Jan20, Jan20 back side. From Jan20, Jan20 on the lateral side. Okay? Then again, what we insert the first needle, Jan20, 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 Jan20. One Jan20 like 3 circle like this.
ಗ್ಯಾಪ್ ಎಷ್ಟಿರ್ಬೇಕು ಗ್ಯಾಪ್
Gap between Jan20 gap. Okay? For
ನೀಡಿಲ್
example, this is your Jan20.
And they're all in 4 directions.
Yeah, this is your Jan20. And your face is this side, this is the back side. I am standing like this. Jan20 first on the anterior. This Jan20 you will use for the mark. You will not use the point, the needle on this point. Okay? Jan20 from here, toward of my nose. Jan20 on the lateral side. Jan20 from this point to posterior side. Jan20 left side, lateral side. Okay?
One more
This
thing.
is the first crown. Triple crown is the 3 crown. Okay? Then one tune will go here again. Second tune is here. Third tune is here. And fourth tune is here. Okay? And again one tune from this same middle. It will go like this. This. Okay?
You never put on the.
We don't put on the Jan20.
Never.
No, in this
When we
case,
are putting Jan20, we use some condition Jan20.
Okay.
But during this crown, we don't use the Jan20.
And when do we use? Okay.
You just use as a reference,
Yeah.
but no good.
Yeah.
Okay?
In crown, we don't need to put any needle due to one thing.
No.
We don't put needle on Jan20. Around the Jan20, we'll put a 3 round of the needle. Okay?
But according to the tongue, like there's nothing for this. You just ask that this is like if they've psychological problems or if they can't sleep or whatever.
Yeah, what we discussed.
This isn't tongue
This
diagnosis.
is the secondary protocol. Again, remember. This is the secondary supporting protocol. What we are going to use, the main protocol is your pathological protocol or as per your pulse. For example, the reproductive. We are using for reproductive this protocol.
Yeah.
After this, we will use this one.
Okay.
Understand?
Second.
For all the conditions, we use the first protocol as per your tongue diagnosis or pulse diagnosis.
Okay.
Okay, but secondary protocol we can use this to balance your white matter and grey matter.
You
Okay.
can use it for everyone, so no.
You can use that, no problems.
So you had said this, but I'm asking again. So on the orthopedic acupuncture, we know we can't do too much harm. We may not do good, but we won't do harm. If we insert the needle and then we get over. So all these protocols also, if I'm using the protocol, can I damage something?
No, what we discussed the point, just all point are very safe point. Okay, what we discussed, because in scalp you cannot cross, you can't cross the scalp.
Yeah, but not
Okay.
really.
Yeah, so in starting practice, this part there is no fat, so it is sensitive part. Okay,
Yeah,
so you can use the inserter. Okay, just use one inserter and use
And
it.
hardly any insertion is
Yeah, many people having a burning sensation in the scalp. Okay, so many people having a burning sensation in the scalp, you can use this protocol. Many people having dandruff issues, you can use this protocol. Okay, so there are some distal points. PC6, PC7, ST7, and RAN17. RAN17 you can skip sometimes. Okay, RAN17 you can skip sometimes. Where is more RAN is more RAN17 more important. When will come on the origin treatment, we'll discuss in that subject. PC6, PC7. Okay, and ST7.
HT7.
H, ST7 and RAN17.
Okay.
Then 17.
Yeah.
What is Jan20?
RAN is central meridian. 17 over between
8
the
is here.
people.
So 7.
If you remember, we discussed about RAN17 is very good point
Oh, this is the
All
exact
this-
between the two.
Yeah. for the chest cavity, for lungs,
You
heart,
open your chest
cardiac.
cavity.
PC6
I know, I understand that, but you do the crown and these points.
here, pointed are here.
Add on.
The
And
patient
on
are sitting like this, the crown here, and this is the point.
And REN 17.
okay.
Center in the center. Okay?
You don't combine the treatment. You do one after you do the other.
No, the both
you
at
do
the
together.
same time. The protocol here and in your hand. Okay?
This still just means like additional points.
There are some stimulation points. For example, move and back is on the organ. This still are stimulating that organ from the far away.
Okay.
Okay?
HT7 ಎಲ್ಲಿರುತ್ತೆ HT7
Yeah, just we are coming on that. Okay? So when you are bending your wrist, there is 3 lines in the wrist.
Yeah.
Okay? The center line. Okay? In the center line, can you feel this tendon here?
Yeah.
Here. In this bone, can you feel the lateral side tendon here? Okay? So inside the tendon. Okay? From the inside the tendon, which is here. If you are putting outside the tendon, that is the SI5, which means small intestine 5 number point. Okay? So there are many confusion in this book. So the point is inside the tendon. Okay? This is tendon. It's just next to tendon, you will feel that gap. Okay? In this gap and in the center your wrist line. Okay? Here is your HT7. Okay? Exactly same between the two tendon. When you check here like this, there is two tendon. Check like this.
Yeah.
There is two tendon. between these two tendon and on the wrist here, on the center line of the wrist, this is your PC7. Got it? So see, this is tendon, one point here, second point here, and third point, which is the PC6, the three finger from the my PC7.
Nerves ಇದಾವಲ್ಲ ಅಲ್ಲಲ್ಲಿ.
That's also on the same.
Yeah, that's also between the two tendon. Here, when you like do like this, you will see the tendon. Yes, this is two. Yeah, this three protocol. This three.
Sir, come please. ಇಲ್ಲೆಲ್ಲ ನರ ಇದಾವಲ್ಲ.
ST7. This tendon, and this is the center line of the crease. ST7, PC7, 3 so PC7, yeah, ST7, not on the tendon, okay? Between this, see, one tendon is this one is one tendon, second is this tendon, between these two tendon.
Oh.
Because this is the center line.
Always trying to avoid these small veins, okay? 1, 2, perfect. This three finger, right?
Yeah.
HT7,
So it's
PC,
7,
and
PC6.
this is
If you see your tendon is little bit like more on this side, when you go forward, when you want to come this side here. See, this is your tendon. Later tendon you have it here, and this side here.
HT7.
If you see old people's hand, then this tendon is coming here.